Coming of Age is coming up next. I'm your host, Emily Echeverria. First today, we're discussing everything about strokes, the signs to look out for, what to do when it happens, and what recovery looks like. Next, we're checking in with the Santa Rosa Sheriff's Office about how they're working to better serve individuals with dementia and their families. Finally, we're learning about how to combat elder abuse in our community. Stay with us. Coming of Age starts right now. As we age, staying active and connected to community can sometimes become more challenging. But with Council on Aging of West Florida's broad range of home and community-based services, you can stay healthy, independent, and engaged in life. From Meals on Wheels and respite care to senior dining sites and the retreat, we provide the support and connection you need to age your way. Aging is a unique journey for everyone, and we're here to help you meet your needs and thrive while preserving what makes you, you. Since 1972, we've been a trusted advocate for elders and a support system for those who care for them. Now, let's dive into the age-related issues that matter most to you. Knowing the warning signs and symptoms of stroke so that you can act fast if you or someone you know might be having a stroke is extremely important. The chances of survival are greater when emergency treatment begins quickly. Here today to talk to us about stroke awareness is Quinston Ephraim Jr., Executive Director of the Nursing Transfer Center with Baptist Hospital. Thanks for joining me today. So first off, let's start with the basics. What exactly is a stroke?
Well, Emily, thank you for having me today. The basic signs and symptoms of a stroke are really simple. We have BFAST, which we're going to talk about a little bit later on. But strokes, there are two different types. You have the ischemic, which constitutes about 85% of strokes. Those specific strokes are just like a busy highway that becomes clogged. In your brain, the blood vessels become clogged by a blood clot, and it will prevent blood from going to the other portions of your brain. And then you also have what we call a hemorrhagic or bleeding stroke. Those are caused by high blood pressure, and those blood vessels can rupture, causing bleeding into the surrounding tissue. Both are very serious and need to be taken care of as soon as possible.
So it's either a clog or a leak or a bleed.
Mm-hmm.
So why do people have strokes? Are there things we can control that can help prevent a stroke?
So there are risk factors that can be controlled and some that cannot be controlled. Some of the ones that cannot be controlled include being over 60, being African American or Hispanic, being female, but then you have those that you can control, things like high blood pressure, high cholesterol, smoking, dietary and sedentary lifestyle changes.
And so I know high blood pressure is something that a lot of people have. What are some of the other risks, like atrial fibrillation?
So atrial fibrillation, that is something that can be controlled with medications. Atrial fibrillation is an irregular heartbeat that can cause the blood within the atrium to form clots. As a result of that increases your risk of those clots breaking loose and traveling to your brain. So some of the big things that I want our listeners and viewers to take away, that if you do feel just a little bit off with your heartbeat, or if you feel fluttering, be seen by a physician so that can be evaluated. And if you are confirmed to have atrial fibrillation, there are medications that you can get on to thin the blood to decrease the risk of those blood clots forming and overall decrease your risk of a stroke.
Gotcha. So how does someone know if they're having a stroke? How might someone be able to, react if they find that they are having one?
So BFAST, as we said earlier, that's BEFASTT. We added the T a few years ago. The first is B for balance. If you have a sudden loss of balance or you just get off in your coordination, that's one of the first signs. E is for eyes. You can have difficulty seeing out of one eye or both. F is face. You can have a facial droop. A is for arms. If your arm strength or coordination on one side or both becomes altered, that could be a sign of a stroke. S for speech. If you have slurred speech or difficulty understanding speech. T is for time. We really have to take every second, every moment very seriously and act on it. And then also the last T is for a terrible headache. That is one of the ones that we recently added, so our potential victims of a stroke or their families and others can realize that a terrible headache could actually be a sign of a hemorrhagic stroke.
Wow. Okay. So I know the time really matters, and the sooner you can get emergency treatment, the less likely it is to have stronger repercussions. But what does recovery look like if someone does have a stroke?
So if once you're brought into the emergency room and you're seen by physicians and evaluated by our stroke team, usually your acute care hospital stay is about 3 to 5 days. From there, you'll be evaluated for rehab, depending on the number of deficits that you have. Usually the first 3 months are very, very important because that's when you're going to see the greatest amount of recovery. But stroke recovery can actually last for years, depending on the severity.
And so if someone has had a stroke already, are there anything different about trying to prevent another stroke?
Yes, so as we spoke about high blood pressure, high cholesterol, you're going to be placed on a series of medications to assist you in that recovery and control of that. But then you also want to make dietary changes. You want to stop smoking if you are a smoker. You want to also start participating in exercise if you can do so. Know your numbers is one of the biggest things that we want our viewers and listeners to know about. For most adults, we're going to try to stick into that range of less than 130 over 80. But if you're over 65, we want you to aim for 140 over 90.
And I think things like high blood pressure, high cholesterol can be something that you just sort of think of, oh, it comes with age, and not take it seriously. So these are things that you really need to take seriously and work on however you can versus lifestyle medicine to help prevent something more serious like a stroke, right?
Yes, and I believe those things start now. You know, you can start prior to having a stroke. If you know that you're at a greater risk, you can always start making those dietary and lifestyle changes now.
Absolutely. And these are the kinds of things that are the things we're told about general health all the time. You know, stay active, know your numbers, eat well, you know, stay away from saturated fats, fried foods, things like that. And that all is stroke prevention on top of everything else.
Yes.
And tell me about support groups.
Support groups, awesome. So at Baptist Healthcare, we actually offer support groups at the Navarre and Pensacola locations. With those support groups, we actually have stroke survivors and their families who come and speak about their experiences. Some of the things that we've noticed within our support groups is that there are some mental or emotional changes that can happen as a result of strokes. And so having that support system of not only clinicians who can give you advisement and guidance going forward, but also seeing other individuals who have experienced a stroke and seeing them in their recovery and seeing their support system on their side, we oftentimes see that builds up our different community members who have suffered from strokes.
Absolutely, and seeing someone else who's gone through it, who is making progress, you know, can really push you forward, I'm sure.
Yes.
So last question, what is the big takeaway that you would say for people?
Big takeaway that I want to give to our listeners and viewers today is know your numbers and be fast. Prevention is key now, so if you're at a higher risk of having a stroke, go ahead and start making those necessary changes in your life. You know, pay attention to your blood pressure, pay attention to your cholesterol, get active, see your physicians, take care of yourself. And then also, if you do experience or see someone experiencing stroke-like symptoms, remember, be fast. Balance, eyes, face, arms, speech, time, or a terrible headache. Every moment counts.
Perfect. Thank you so much for joining us.
Thank you for having me.
Stay tuned. We're discussing a community challenge regarding individuals with dementia next.
Navigating healthcare is hard. Baptist makes it better. With convenient locations, easy scheduling, and skilled, compassionate doctors, all when you need us most. The next time you need care, let Baptist make it better. Baptist Healthcare.
The Reesburg Institute, Pensacola's Ear, Nose, Throat, and Voice Center. We welcome you to visit us at our convenient Davis Highway location in Pensacola. At the Reesburg Institute, we offer the most advanced treatment available in a calm, stress-free environment. Since 2014, we've performed over 1,000 cases in office of balloon sinus surgery, as well as septoplasty and nasal procedures using oral sedation. The in-office procedures result in a faster healing time. Visit us and feel the difference.
Animal Allies is looking for volunteers, and there are many ways that you can help. From taking care of cats to using your computer and social media skills, any and all assistance is greatly appreciated. We have morning and afternoon shifts every day or help at adoption events. You can even foster a kitty at home. And it counts towards community service hours for bright futures. Find Animal Allies Florida on Facebook and Instagram or go to aaflorida.org/volunteer.
Keeping your family healthy can be complicated. Baptist makes it better with trusted primary care doctors for the whole family and trusted specialists at convenient locations throughout the region ready to care for you. All when you need us most. Let Baptist make it better. Baptist Healthcare.
I taught for 20 years, but I started forgetting my lectures. Eventually, he had to quit. My therapist recommended we go to the doctor. The early Alzheimer's diagnosis allowed us to take control of the situation. He's been such a positive force and so loving. Thank you. You're welcome.
If you or your family are noticing changes, it could be Alzheimer's. Talk about seeing a doctor together.
When law enforcement officers interact with individuals with special needs like mental health issues or disabilities, they need training, tools, and resources to assist those populations safely and positively. Similarly, when dealing with individuals with dementia, law enforcement agencies need the right practices in place, especially as this challenge increases in our community. We have Angela Nandon and Deputy Andrew Carey with Santa Rosa Sheriff's Department to tell us more. Thanks for joining us today.
Thank you for having us. Such an honor.
So, are you seeing more cases in the community with people involved with people with dementia?
Absolutely. It's increasing rapidly, more than what we were probably expecting. And it could go anywhere from people having, dementia, Alzheimer's, to somebody also being scammed in fraud cases. Deputy Carey, you get calls like that all the time.
Yeah, it's definitely increasing. It seems to be the vulnerable population taken advantage of with these frauds, significantly increasing, and the amounts have been increasing. And in general, we're starting to see a lot more situations where people are wandering from home, or they're driving to unknown locations, or they're getting lost and they don't know where they're at. And it seems to be almost a daily occurrence now.
Mm-hmm. And it's only going to get worse as the population continues to age and dementia becomes more prevalent in the community.
Absolutely.
So what are some of the big concerns when you have to go out and deal with someone with dementia and they're having interactions with law enforcement?
Safety is always our priority. We're trained to de-escalate and recognize the symptoms of mental health, but also dementia and Alzheimer's. One of the situations that we often deal with are people with dementia and Alzheimer's get scared. They don't know what's going on. They feel like they're under attack. We've had situations where they've armed themselves with weapons, where they've attempted to attack spouses, family, officers, but they don't know what's happening. So we do everything we can to try to de-escalate those situations and get them into resources and help that they need. And unless we absolutely have to, try not to enforce any arrests. Try to get them into a medical facility to where we can actually get them care and resources set up.
And I know sometimes there isn't another option, and so they have to be taken into custody for the safety of themselves and maybe the person that they're living with.
And if we do take them into custody, we also try to get with the state attorney and try to get them to where instead of just putting someone in prison or jail, we get them to mental health facilities and get them to get evaluations done and get social services involved to actually get them into the care that they need.
Yes, right. We're very lucky with them.
And you just touched on this, but what are the current kind of protocols or practices that you use when you are dealing with people with dementia?
So of course, de-escalation. We want to do whatever we can to be patient and calm. So when the deputies are there, they can de-escalate the situation. So there is no safety risk for the deputy or the individual with Alzheimer's or dementia. We want everybody to be safe. That's always our number one key. And deputies will say things calmer. They'll change the way that they're interacting with somebody. So this way, everybody feels safe.
And what would an ideal solution? What do you need to make this better? Are there policies? Are there practices? Are there programs that you would maybe want to enlist to help these situations?
We're kind of trying to lead the charge on this. A lot of people are familiar with the Baker Act law in the state of Florida, but the Baker Act law is meant to be used for other issues with mental health, schizophrenia, and related issues. Alzheimer's and dementia is a medical issue. So we try not to Baker Act, but if we absolutely have to, we will. Some form of legislation update that we're working on right now as an agency is to try to pass something similar but different to where we can get these people in and get them to where maybe some cognitive testing can be done, get them into resources, because a lot of the stuff that involves law enforcement interaction is these people need round-the-clock specialized care. They need to be in a secure facility with doctors and nurses that take care of them. Because unfortunately, it's not their fault, but a lot of family members don't have that capability to do that. The amount of times we get called out at 3 in the morning for somebody that's wandered from home, you can't be awake 24/7 like a nursing home can. If we can get them into a hospital and we can find out, do they have Medicare, do they have Medicaid, do they have private insurance, and the doctor's offices can get that information and actually get them into the system, we've had success rates of 24 hours getting someone into a facility from a hospital. That's our ultimate long-term goal, but we're kind of breaking ground on trying to do this and making it a state level thing.
Yeah,
Right.
because at the end of the day, the deputies cannot, if we get called out and we have somebody who has Alzheimer's or dementia and they're chasing their spouse around with a hammer, that's a big safety concern.
Absolutely.
And so we need to find the proper care where they can go so everybody is safe.
And it is very hard too, because if we do Baker Act somebody, if we Baker Act them or arrest them, we are taking away their rights. And we are putting them into custody. And unfortunately for people that don't know what's happening, it's extremely terrifying for them to be taken into custody. So hopefully with us having a medical option to get them into a secure facility to where, well, maybe EMS takes them instead of them having to go in a patrol car, it's a lot safer facility, a lot safer transport, and it just makes it a lot better for them and us.
And what advice do you have for family members of someone with dementia for avoiding these situations or being prepared in case they do happen?
Be prepared. Get your finances in order. Meet with any legal teams you possibly can, because it could reach a situation where, somebody has to be taken out of their home. So what are you going to do about that? How prepared are you with having all your medical information written down? I always like to tell families, put your medical information on the side of your refrigerator. So this way, if a deputy has to access it or EMS has to access it, they could see like what medications they're on or whatnot. But really being prepared for if things need to, take place and they have to leave their home, everything is done and taken care of. So the more information you have, the better.
Taking a proactive approach as well, because one of the things that we've noticed is that the people that we deal with that are having episodes, the disease has progressed already. Taking a proactive approach to have power of attorneys, directives, and under other care directives set in place to where if, God forbid, some family member starts going through this, to where these power of attorneys activate and we can get them care, that helps us in the future. Because a lot of times, if that's already in place,
Yes.
and they go through a diagnosis, it's a lot easier to deal with that than somebody who is not diagnosed, but we have no lawful authority over a power of attorney or anything else to get them into that kind of care.
Gotcha. So be prepared. Once you see the signs, start getting things in order.
Absolutely.
Secure your finances, secure the paperwork.
Yeah.
Be prepared. Create a little box, put everything in there. So
Avoid these worst case scenarios.
avoid the worst case scenarios.
Excellent advice.
Yeah,
Thank you
because
so much.
going through the system is not the easiest.
Yeah, definitely.
Yeah.
Complicated mess.
Yeah.
Well, thank you both for being here.
Well, thank you. We were honored.
Up next, we're discussing what to know and how to report elder abuse. Stay with us.
I don't know why you're so sad. You've got a roof over your head.
Bro, you gotta stop with that depression stuff. That's a white people thing.
Escúchame, en esta casa los hombres no lloran.
You alright?
It just feels like it's coming from everywhere.
Do you want to talk about it?
Thanks for hearing me out, bro. Appreciate it.
You can talk to me if you're feeling sad. Whenever you need to talk,
I'm here, okay?
¿Qué color? Perfecto, mijo. Gracias. Thank you. What's wrong, mijo?
Donating to a pet's medical care is one of the many ways you can help families in your community. Pets and people belong together. Learn more at petsandpeopletogether.org.
When you look at me, you might see
a person with Parkinson's disease.
But if you look closer,
you'll see
a warrior mom,
an endurance athlete,
someone with a lot of fight.
Every 9 minutes, someone is diagnosed with Parkinson's disease.
And every one of them can turn to the American Parkinson Disease Association.
Look closer.
My spirit
is unshakable.
Visit apdaparkinson.org to learn more and show your support today.
Do you want to meet a family with a transgender kid? Here we are. We love our kids unconditionally, and we will never stop fighting for them. Stand with us. Protect our families.
Next month is Elder Abuse Awareness Month, and while this is a challenging topic, everyone in the community should know the signs of abuse and the resources available for victims. Sadly, research indicates that 1 in 10 older people living independently are affected by abuse in the United States. To learn more, we're talking with a local expert on the topic. We've got Marci Symms from the Northwest Florida Area Agency on Aging. Thanks for being here, Marci.
Thank you for having me. I appreciate it.
So, first of all, elder abuse doesn't always look like what people think of as abuse. So, what forms of abuse can elder abuse take?
So that's right, Emily. So elder abuse can take many forms. It's any intentional or negligent act that causes physical harm or harm to an adult. And it doesn't necessarily have to be physical harm. It could be physical, emotional, financial, neglect, self-neglect, and things along those lines.
I know self-neglect is one that we talk about a lot because it doesn't seem like you would call an abuse hotline for someone not taking care of themselves, but that is considered abuse.
That is correct.
So what should someone do if they're the victim of abuse or if they suspect that elder abuse might be taking place?
So in the state of Florida, everyone is a mandated reporter for abuse. So they would need to call the elder abuse hotline, which is 1-800-96-ABUSE, or that can also be reported online at myflfamilies.com. Apologize.
We'll put that on the screen in a graphic so that people will know, because I know a lot of people also don't want to call a number. They want to report online. They would rather do it, through a digital way instead of talking on the phone.
Correct.
And better to report and have it looked into than let abuse go unacknowledged.
Correct. And it's also the person that's reporting, it's not their job to determine if the abuse has taken place, it's their job to report it.
Exactly. And tell me about World Elder Abuse Awareness Day.
So World Elder Abuse Awareness Day is June the 15th. This year we're going to have an online virtual event that will be available via a QR code. That will take place on June the 10th at 9:30 our time.
And what will be going on at this event?
So at that event, we will have speakers that will be speaking about from a law enforcement perspective, a financial perspective, and also the legal perspective of elder abuse.
Gotcha. And what's something people may not know about elder abuse?
As you stated already, elder abuse affects 1 in 10 elders annually, so it's more prevalent than what we understand.
Absolutely. And what should someone do if they're being abused, if they're the victim of abuse?
They can also report. That would be the first best step, to report the abuse either online or via the 1-800 number.
And what if that person that is abusing them is their caregiver and they are relying on them for, food, shelter, caregiving, etc.?
They just need to understand and know that they are not alone, that there are programs and resources out there that can help them. And the first step would be to report the abuse.
Absolutely. Is there anything else people should know about elder abuse or the resources to prevent it or stop it?
So they could also reach out to us. We have lots of resources, so that would be through either our website, which is nwflaaa.org, or they can call our elder helpline and get resources.
Absolutely. And tell me a little bit more about kind of some of the different types of abuse that take place in our community. Are there certain things that are happening more often, or certain like types of abuse that are more common?
So the more common types of abuse would be the neglect or self-neglect, which is more common things that we see.
Mm-hmm. I know our case managers go out for some of these cases, and if someone will just stop taking care of themselves to the point where it's becoming a crisis situation, and that's when Adult Protective Services might get involved. So tell me about what that process is like. So someone has called and reported abuse. Maybe it is an extreme self-neglect. What happens then?
So once they call the elder abuse hotline, then the Adult Protective Services investigators go out and do an assessment of the home, assessment of the person, and then help them get linked up with resources.
Mm-hmm. And in some cases that means services might start in the home, very quickly to get them stabilized and in a safer situation.
Correct.
Any last words about elder abuse or mandated reporting?
Just everyone in the state of Florida is a mandated reporter. Again, you don't have to prove that the abuse is taking place. It's your job to report it.
Absolutely. So if you see something, say something, basically, when it comes to older adults in the community and possible abuse.
Correct.
All right. Well, thank you so much for being here, letting us know about World Elder Abuse Awareness Day and what to look out for and how to report.
Perfect. Thank you so much.
And thank you for watching. Until next time, enjoy life. You've earned it.